Okay, go.
Hello, my name is Jessie Ann, and I'm going to be giving you an assessment today. I provide privacy, wash my hands, inspect the area, make sure it's safe and secure for the patient. Alright, could you please state your name and your date of birth?
Ruthie Levacy, March 12th, 1996.
Okay, and do you know where you're at?
Decker Hospital.
Okay, and do you know why you're here?
Just for a regular checkup.
Okay, because my patient answered my questions, she is alert and oriented. Are you experiencing any pain today? Okay. If she was experiencing pain, I'd go through O parts, which is onset, location, duration, characteristics, alleviating, aggravating factors, related symptoms, treatment, and severity of pain. Alright, since you're not experiencing any pain, I'm just going to do a full body assessment real quick on you. Alright, so I'm going to start with hair distribution. So I'm checking, making sure it's good on her head, her arms. Alright, I'm just going to pull the cover back. Her legs, as well as her toes. All that looks good. So hair distribution is normal. Next, I'm going to check pearl. So if you just look at this light for me. Okay, pupils are equal, round, and reactive to light. Next, I'm just going to palpate her lymph nodes. So I'm checking to make sure they're mobile, non-tender, and not distended, and they're not, so that's good. Next, I'm going to check and make sure her trachea is midline, so I'm just going to put my hands on the front, probably third. Okay, trachea is midline. Next, I would prop my patient up to a 35-degree angle. Alright, and I was checking for JVD. No signs of JVD. Next, I would palpate my patient's face. Okay, checking for symmetry, making sure, again, like the muscles are symmetrical and things like that. So all that checked out good. Next, I'm going to assess temperature. Alright, using bilateral technique. Okay, temperature is good. Her skin is clean, dry, and intact. It's also warm, so good temperature. Her color is the color supposed to be for her ethnicity. Then I'm going to check pedial pulse, no, radial pulse first. Okay, and then the posterior tibialis pulse, and then the pedial pulse. Alright, all those check out normal, and they're all 2+. Next, I'm going to check capillary refill. Alright, and all those are less than 3 seconds, so that's good and that's normal. Next, I'm going to palpate, or listen to, I'm going to, can't think of this, crepitus. I'm going to check for crepitus in her chest. Alright, there's no signs of any crepitus, so that's good. Next, I would also take 8 on the front, 10 on the back. I listen for 1 full inspiration, 1 full expiration. Next, I would check her heart sounds in the 5 different regions. Get my stethoscope. Alright. So I would check aortic, pulmonic, Erb's point, tricuspid, mitral. And I'm just listening to make sure S1 and S2 are present and they're regular, which they are. Next, I would, and her breathing effort and is good, it's normal. Her breathing rate is also normal. I listen for her respirations and make sure they're between 12 and 20. That's normal. And so next, I would auscultate or inspect her stomach, make sure it's symmetrical, non-distended, no masses, nothing of that nature. So I'll do that, and then I would auscultate each quadrant for 15 seconds. And then I'd palpate whatever quadrant is hurting her last. Okay, sorry. So I palpate her stomach, again, no masses, no tenderness. Then I would also assess her body, make sure there are no signs of edema, making sure her muscles are also symmetrical throughout her body. And also just like do like an overall inspection of her face and make sure there's no odd masses or anything like that. And again, checking through her body, no edema, no abnormal masses. So that's good. Next, I would do range of motion. So if you could abduct your arms, so pull them away. Could you adduct, put them together? Could you flex your arms? So just flexing your muscles and extend your arms. Okay. So she has full range of motion. And if you could squeeze my hands. All right. Muscle strength is good. 5 out of 5. Muscle function is good. No signs of like weakness or anything like that. No signs of weakness. Surface structure is good throughout her body. Skin color is normal. Hair distribution, pearl, crepitus, auscultated lungs, tissue heart. Alright, finished.